Hello, wonderful friends. You are welcome to Lead Nations TV. Today, I'll be continuing the series of training sessions and motivational sessions that I've done previously on how to be a light to your world. How to be a light to your world. And the first thing I talked about has to do with influencing the political and government sector. I've also talked about influencing the business and economic sector. I've also talked about influencing the educational sector or the instructive sector. And today I'll be talking about influencing the health sector, the medical or health sector. And I want you to know something. One of the reasons why we're doing what we're doing is to inspire people all over the world, inspire people in Africa, inspire many people in Nigeria to take up responsibility towards making sure that they influence every aspect of their being, every aspect of society according to the giftings, exposures, professionalism that everyone has by reason of chance, hard work and commitment or vision, dreams and aspirations have gotten himself or herself into. Before I talk about the issue of health, I want to let us know that I've been so worried in recent times. Today exactly is the 30th day of March 2022, and it is important we listen to me to know why I'm doing exactly what I'm doing. A little bit early this year, I was called upon by one of our team members who is a public health expert, and she asked me to, there was an emergency, and she asked me to rush down to a particular location where I stay in southeastern part of Nigeria. And I got to the place and I saw a man. The man was already dead, as it were, and I had to drop a cup of water on him. The man did not make movement, and I began to question and discovered that the man collapsed because of a whole lot of pressure on him, and then the transport people dropped him there, and nobody could give this man the required attention. This man that is in a little bit early, he's in the early 50s, about 50, 54 years. He's a catechist in a Catholic church. That's what we finally discovered. And this man had a kind of maybe heart attack, or he had high blood pressure challenge, and nobody could help this man. Nobody could call. There's no emergency health system that could save this man. By the time we got to the place, the man was dead. So I had to just stay back and call his people to come and pick his cup. So it began to put a lot of worry inside my heart of what we're going through in Imo State and what we're going through in Nigeria, what we're going through in Africa especially. And this is one of the things that has actually motivated me to push and to inspire everyone that is in the medical sector, and as many that will have this motivation to be part of that is going to actually help out. Something also happened just about last week or two. Yes, last week. A very wonderful, talented young man, a musician, a gospel musician in Nigeria, just passed on. What was the problem? This guy had kidney failure and he needed kidney transplant. And because of some kind of complications, he also had cancer of the blood, otherwise known as leukemia. And this young man, from his statement, he was actually taken care of, and the kidney something was rectified after going through some excruciating pains of dialysis. And then before they could put together a lot of visa documents, as they said, this young man died before they could put up the visa to take him to India to handle the issue of leukemia. And this is very, very sad. Why this is very, very sad for every one of us? It could actually happen to anyone. Why? Because of the poor infrastructure in the health sector in Nigeria, in Africa. It's so sad that a lot of money has been spent by our political leaders. A lot of money is being spent by a whole lot of senators in their constituencies, House of Rep members, and there is no medical facility. There is no cottage hospital. We don't have primary health care. Is weak in different aspects of our geographical location, be it in your county, in your state, and the nation at large, and also the continent of Africa. I want to read something to us, that a documentation that I'm going to use as a foundation, and it's going to serve as a motivation to every one of us who desire to be part of this revolution, the health revolution in Nigeria, the health revolution in Africa. I want you to understand this, everyone. Let me just read this. He said, there is a toxic mix of problems, including inaccessibility of quality health care, poor hygiene, malnutrition, lack of access to safe drinking water, poor health infrastructure, fake drugs, insufficient financial investment, and lack of sufficient health personnel. It was actually a documentation that was actually giving an analysis about the deteriorating health situation in Nigeria and health situation in Africa. On September 19, 2019, this is from Abuja, for years now, it's actually been established that Nigeria's healthcare network has been rated among the worst in the world. Among the worst in the world. A 2018 study in the Lancet of Global Healthcare Access and Quality ranked Nigeria 142nd out of 195 countries. 142nd out of 195 countries when it has to do with global healthcare accessibility. I want to also let us know something else that was actually brought before our notice. He said that the top 4 problems of the healthcare sector in Africa countries identified by individual participants were inadequate human resources, poor resource allocation to health, poor health maintenance of healthcare systems and infrastructure. And he says some of the key issues highlighted were limited access to healthcare facilities, lack of adequate personnel and expertise to address medical needs in Africa and in Nigeria. Poor infrastructure, I've also mentioned that, and their facilities to handle medical challenges. Some other persons from some other school of thought said political instability is playing a very strong negative contribution towards the deteriorating health situation in Nigeria and Africa. They also talked about corruption, limited institutional capacity, and unstable economy. I want us to understand these things finally. It says fewer than 50% of Africans have access to modern health facilities. Fewer than 50% Africans have access to modern health facilities. It said many African countries spend less than 10% of their GDP on healthcare. Also, there is a shortage of trained healthcare professionals from Africa because many of them prefer to live and work in places like the US, Europe, and all the rest of them. Here comes the reason why I'm doing what I am doing today. In recent time, there was this advertorial that went online asking for Nigerians who want to work, I think in Afghanistan or something, and the crowd was actually massive. One is wondering, what's going on? What's going on? In line with these statistics and these documentations that I have read before us today, one is wondering what is going to become of 200 million people, 200 million plus people who are living in Nigeria, and more than about 3 to 4 billion people are living in Africa, when we have less than 50% of Africans who can actually access quality health care. And also we're having about 10% of African nations spending 10% of their GDP in the area of health development. I want everyone to listen. We're not here to throw blames on anybody. I am here to make sure that I inspire a whole lot of people listening to me today to go into the medical industry, the medical sphere, because each and every one of us, we have a particular role to play. And I want you to know something, that we need to start motivating our people to go and study medicine. And then also we need to get involved in politics. We need to begin a kind of revolution in the area of health advancement in Nigeria, in Imo State, southeastern part of Nigeria, and also the African continent. I want everyone that is listening to me who desire to expand the lives of people in Nigeria, in Africa, to get into the health sector. We have had enough of entertainment. We have had enough of leisure. We need to begin to preserve the lives of people. We need to increase the average lifespan of Nigerians and Africans from 45 years, according to statistics, to about 85 years by increasing the quality health care, by improving on our health infrastructure, by improving in the establishment of institutions that can actually train doctors, and making sure that we deal with the issue of corruption, the issue of political manipulations that have actually affected the care and the remuneration that is given to medical experts. I want to motivate you, if you're a public health person, if you are somebody that is involved in any aspect of medicine, whether it's hematology, parasitology, whether it's pediatric medicine, gynecology, or you're involved in epidemic control, or you are a virologist or a parasitologist, as the case may be, or you're a pharmacist, or you're a nurse, or you're a public health expert, or epidemiologist, I want you to know that you have a responsibility. You have what it takes to engage the health sector accordingly. I know you have lost a whole lot of hope in the government of Nigeria and in the governments that are found in several nations in Africa. But I want you to know something, that for the fact that you are watching this video today, for the fact that you have this passion in your heart, you are so worried when you see people die carelessly, you are so perturbed when you see people who are not supposed to die. It means that there is something inside of you that could inspire a revolution in the health sector. Listen to me. You don't need to be a doctor. You don't need to be a pharmacist for you to be part of what I am talking about. You can actually pool some resources and start a medical revolution by setting up a hospital, by setting up a pharmacy, and then bringing the pharmacists to take charge of the company, the establishment, and so that people around you can actually have access to quality healthcare delivery in that particular location. I want to inspire some people who have extra cash. I want you to set up a hospital in your community. I want you to set up a hospital in your state. I want you to set up a hospital in your nation. I want you to do it with a certain level of a human, what do I call it now? Do it with a whole of human consideration, making sure that in as much as you are going to make money, but you must make sure that there is the place of humanity behind the establishment of that firm. That's what I'm talking about, and that's why I'm here to inspire everyone that is listening to me. And if you are a commissioner of health, you are a minister of health, you are involved in one particular aspect of government in the health sector, I beg of you, I beg of you to get involved in something that is positive. People are dying in Nigeria. People are dying in Imo State. People are dying in Africa. Our organization, the Faithhouse Leadership Ward, we have decided to set up an emergency system in our locality. We have also decided to set up a Faithhouse hospital, a specialist hospital that is going to attend to people. And this is what we're doing in our little way. While we wait for the government to do the needful, to open up the system so that there could be importation of drugs. Could you imagine a very wonderful musician died in Nigeria? Why? Because someone was actually waiting to get a visa that's going to take him to India for ordinary cure of leukemia. Somebody say leukemia is not an ordinary cure, but I want to let you know it will just take just a pass-through sum of 3 billion to set up such kind of infrastructure in Nigeria, in Africa, so that such kind of persons of good quality disposition in the music industry can actually be alive. There are so many people that have died who are not supposed to die in Nigeria. There are so many people who have died who are supposed to die in Africa. There are so many people who have died in Imo State, where I live, who are not supposed to die, but because they have not been able to have access to quality health care, they cannot have access to good doctors, and no more there. And I want us to understand this, that it's important to begin to look for the people who that have so much passion for people. We have people who are president of nations, senators, House of Rep members who do not have passion for human beings. They don't even bother whether people die. If there's an accident in any place, you find out that the death rate is going to be massive. Why? Because we have the wrong people that are governors, wrong people that are senators, wrong people that are House of Rep members, wrong people that are presidents of nations who do not have passion for people. Just like I read before I got into what I'm saying now, a lot of medical doctors, they want to study outside the country. They want to go and practice where their word is given a very positive consideration. We need to begin to give attention to our medical doctors. We need to begin to give attention to our pharmacists. We need to begin to pay them well. I wonder how someone as a governor or a president will sit down and be owing medical doctors, and be owing nurses, and be owing pharmacists, and be owing people that are taking care of human beings and taking care of their health. Just like what we see in our country, our president will be sick and then he'll fly out to go and take a medical assistance or get medical assistance. That's so sad. I've not seen that happen in US. I've not seen that happen even in any of these Arab nations. I've not seen that happen. But it's always happening in our nation, Nigeria, in our continent, Africa. So I am so worried. I'm so bothered. I'm here to inspire you. Get into that and do something for your community, for your state, for your nation, or for the continent of Africa. And for you that is a child of God, for you that is a Christian that is watching me, you have a responsibility to make sure that this happens in your church. Inspire your pastor, motivate your pastor, talk to your pastor to get out a section of the monies that is being received in the church. Let's set up a hospital for the church, set up a hospital for people to come and get medical attention. As we do that, we're going to be championing a whole lot of medical revolution in Imo State, in Nigeria, and in Africa. We need to make sure that we play the role that God has given to us as people of God so that we can actually save lives. People are not supposed to die at 40. They're not supposed to die at 30. People are not supposed to die at 26. People are supposed to die about 80, 90, 100 years. And the reason why people die so young because of this issue of poor medical accessibility in our continent, in our state, and in our nation. Till I see you next time, I want you to call me on this number, 0803-500-3594. If you have the money but you don't know how to start, we're going to expose you to some consultants who are going to help you start up whatever you want to do. And if you want to support us, you want to be part of our team, fine and good, that's okay. We'll work together. The vision is one. As we make progress, we inspire you to be the best for your nation, for your church, for your religion, for the society, and for your community. Till I see you next time, I remain your friend, Barr.Ikenna Emmanuel, the president of iGold Africa. Till I see you, do have